Dr. Kevin Wissman here. I'd love it if you would just introduce yourself to everyone and let us know where you're joining us from and what
Hi,
your
everyone.
specialty is.
Yeah, I'm Kevin. I am a retired clinical pharmacist, and now we're in Colorado Springs, by the way, me and my wife here with Tame the Migraine. And so we are a migraine health coaching company where we serve women right now and basically helping them try to get rid of their migraine altogether and really transform their life. Or one thing that I always described myself when I had chronic migraine was I felt like I was surviving and now I'm thriving. So helping people go from surviving to thriving with their migraine.
Tell us a little bit about your story. I had migraines myself for years when I had a few car accidents, and one was pretty severe. And I guess the neck trauma was transmuted up into my head. That's what the neurologist said. They had me on all kinds of medicines, which mostly did not work. And then I ended up with a lot of neck pain and body pain, which I used a lot of holistic practices to eradicate. But tell us a little bit about your story and how you got rid of migraine.
Yeah. Well, I'm so happy that you found your way out too, and you know how debilitating and crippling it can be. My story. So I actually had vestibular migraine as a kid. I would get car sick. uh, In the car, I couldn't read a book. I couldn't do anything other than sit there and look off on the horizon. I thought that was odd, but never made anything of it. And most people don't. And then when I was 12 years old, I started to get what I thought was headaches as a junior high, and that's not normal. Most kids are very resilient and can handle stress, and but they wouldn't be getting a headache or even a migraine attack. My parents didn't know anything otherwise. And then I got into college, and I was hit by a car twice on my bicycle, so I had many car injuries. One time, the lady was going 45 miles an hour, and frankly, I should be dead, but I think I was kept alive by God or whoever you believe in to be doing this work. Uh, but yeah, so I've had a lot of neck injuries. I played college football. I've had multiple TBIs or concussions too. And my migraine kept getting worse and worse with time. And I was reflecting back to my childhood, and I was like, it's kind of odd to think about my childhood and teenage years popping pills, taking like ibuprofen and Tylenol. I thought it was normal because I did it so much, and most people do too. But looking back, that's not normal. And then I got into pharmacy school, and my migraines started getting really consistent. Every Thursday, I would get a migraine attack. It ruined my Friday at school, and then work on Saturday. But didn't think much of it, right? I'm resilient. I'm young. Then I went to residency and fellowship, and I was thriving. I was chief resident. Um, just I was doing all the right things, but my migraine started getting worse, where I was like having to call off sick, and then COVID hit. I was lucky enough to still graduate and get honors as resident of the year. So like I was still performing at this really high level, but also secretly the migraines were getting worse. I just overlooked it because I didn't want to have a flaw. I wanted to feel flawless, I guess, and perfectionist that I struggle with. I'm a recovering perfectionist and people pleaser. And I loved what you were telling me before about your people pleasing tendencies and the work you do. So cool. I'd love to learn more. Then I became a professor at the University of Kansas Medical School, and I was spending probably 50% of my days laying under my desk with the lights off, not working because my migraines were so bad. And it's crazy. Like, I think we all can resonate with this, that like we just kind of normalize when we have a condition that slowly gets worse. We just think it's normal. And it was crazy to think I was working from bed in a dark room under my desk 50% of my days and just normalizing that. When I say it now, it's like obviously things were bad. But, anyways, um, things got so bad, I started thinking about taking my life. And as a clinical pharmacist, obviously I tried all the meds and they kind of worked, but there was always, I knew something was missing. I saw all the physios, kinesiologist, OMT with the DO, chiropractor, physical therapist, acupuncture, cranial sacral therapy, like everything. I tried everything, the supplements,
Mhm.
nothing worked. And then I finally started to do the research myself about the nervous system and the role that it plays in neuroplasticity. How
Mhm.
our nervous system is always changing, our brain is always learning and changing from womb to tomb. from the day you're
Yep.
born, or even before then, right?
Right.
To tomb to our last day on this planet. And so doing a lot of neuroplastic work to kind of change my nervous system. And now I've been in remission for about 4 years. No migraine attacks. So that's my story. Long, sorry.
That's fantastic. We have a similar arc. And yes, a lot of times when people come to us with overwhelming anxiety, with panic, it's because they've spent a life not living for themselves. They have people pleasing tendencies. They think that if I can just control my environment and if everything can just be perfect, which is, of course, a really lofty and unrealistic expectation, then I'll be okay. And so they spend a lot of time trying to control the 3Ds. And in my book, the 3Ds are deny, distract, dissociate. And the 3D world gives us plenty of opportunity to do that, to deny, distract, and dissociate. Thank you for sharing your story. And we find that so many of the women who come through our doors do struggle with, or at least previously struggled with migraine in some way.
Mhm.
Maybe it's part of their story and then the panic set in, or they might deal with both. Sometimes it's migraine that's very debilitating, sensitivity to light and sound. I've been there. And then other times it's the waves of energy. And no matter what, we're talking about, as you say, nervous system dysregulation. And what we want, of course, is nervous system regulation. And a lot of the crossover between what we do is regulating the breath and
Yeah.
really noticing the breath. So, do you want to speak to that?
Yeah, absolutely. One other thing, because I don't know how much you do with trauma, but I imagine considering the people pleasing
Yeah.
perfectionist tendencies. Um, so migraines, they're about like the research is it's invariable. 20 to 60% of migraine cases have a genetic component to it. Mine did not. But one strong component for me that I think a lot of people overlook, and probably panic attacks too, was a trauma as a kid. And it's not always the big T trauma or whatever you want to call it. Mine was deprivation trauma. And this is a lot of people don't know what that is. And so I just wanted to share and explain. Deprivation trauma for me was emotional neglect. And my parents are absolutely amazing. They love me. They just didn't know how to express the love that I needed. And so I never felt safe. I never felt understood, and I never felt loved. Like, I could tell people I knew I was loved. My parents, never abused me in any way. It was just I didn't receive the type of love I needed, like the 5 love languages. And so I lived that way my whole life. And I was just getting more and more dysregulated as a kid. And so, like, these started to pop up, and then I started to get an oversensitive nervous system that started to turn into migraine attacks. So, I just wanted to share that. And back to your question about the breath, I had never understood, like, I mean, I went through residency fellowship. I have a doctorate in pharmacy. I worked at a university, and I had never learned about the role the breath plays, like, at all. And as soon as I did, I mean, it was just so fascinating to learn how we can control our nervous system. We can control our heart rate variability. We can, like, impact our vagus nerve and our thoughts and our emotions simply through our breath. And that sounds crazy. That sounds too simple, but there's tons of neuroscience behind this too. So yes, like, one of the strong things we do is breath work. It's like the first pillar that we really teach our clients through is breath work that gets someone into a very regulated state. And so one of the things we teach about in practice is the 5 wave frequencies of the nervous system, the brain, or any nervous system, whether it's your heart, your lungs, your gut, whatever it is. And so we're trying to get them to an alpha wave frequency. When we're dysregulated, we're often in a beta wave, erratic, very fast, causing overthinking, catastrophic thoughts. And so there's many tools and techniques, but we find the breath to be one of the most powerful. Um, yeah, I'm talking too much. What about you? You really had caught
No,
my
I'm
attention when you were
it's a
talking about breathing in and out through the nose.
yeah, I mean, this is a good chin wag because I I am really Well, I'm certified in trauma. I don't talk about all the traumas that I've experienced, but they were all a gift. I believe that whether it's emotional neglect or, a lot of our clients don't realize that they've got some attachment issues from childhood, whether that's avoidance or a lot of anxious attachment, which can actually cause a lot of anxiety. That anxious attachment, or even the combination of anxious avoidant attachment, is a result of trauma. And like you say, I call it big T trauma and little t trauma too, that we can regulate our nervous system with the power of the breath. We can actually watch the mind. That's that mindfulness that everybody talks about and seems so far reaching, but it's really just getting curious about what our mind is telling us, because we don't have to believe everything that we think.
Right.
And I think that a lot of people think about breath work. And so we call it breath worth. It's really tapping into how you are so worthy. I mean, you spoke about suicidal ideation, and I definitely experienced that myself at various points during my life, especially right before I had all these big recognitions that I am in control of my destiny. It's like, I don't really want to kill myself, but it's something along those lines of not
I don't
wanting
want to
to
be here.
be here. And so it's that worthiness and realizing that because I have breath in my lungs, I am worthy. I am worthy of this breath,
Mm.
and utilizing the breath to direct our thoughts and being able to actually cleanse the nervous system. We use a certain breath up and down the central channel, and any areas of discomfort, we're like grabbing the breath with us in order to cleanse that area so that we can regulate the nervous system as well as regulate what I call the itty bitty shitty committee here in between the ears. Because a lot of times it'll tell us really crazy things like that we're not worthy and we're not loved and that we're not important, and we get to decide. We get to hold that very, very differently. So I love what you talk about here, as far as, I mean, you're trained as a pharmacist, a clinical
Yeah.
pharmacist. You know about the placebo effect, and basically, people talk about mind over matter and how powerful our minds are. And I really love just the fact that everything's popping in and out of the quantum. With quantum physics, there is no superposition of these tiny little particles inside of any particular atom until it's observed, and it's the
Yeah.
actual act of observation that causes those particles to collapse and then to decide on their superposition. And so I know we talked in the green room before we hit play here. I know we talked about that placebo effect and the fact that a lot of these drugs that people take, they'll do surgeries on people, and even fake surgeries where people will I don't have any more knee pain. And it wasn't even a surgery. They just did a little incision and sewed them up and told them that they had their knee surgery.
Crazy. It really is. I love that breath worth. I'm gonna steal that from you.
Oh, it's
Um,
trademarked. So good luck.
Trademark, dang it, I can't steal it. I'll pay you for it somehow. We always talk about, I'll come to the placebo, but I had a really wise client that said, it's called breath work for a reason. The word work is not always easy. It sounds easy, but when you actually get into this work, like, it's not always the easiest thing to do. And that's not to shy you away, but like, you're putting in effort, you're putting in time, you're putting in consistency and commitment and quality of breath work, right? And I think you, of all people, taught me that there is a right way to breathe and a wrong way to breathe, and it can be quite technical. And so, sure, try it on your own, but don't give up if a YouTube video didn't fix it for you. Go to Sarah and yeah, get taught the right way.
Well, and it's definitely like we were talking before we hit play here, the layering of it's, a lot of people are like, nothing works. And you want to say, well, how long did you stay at it?
Hmm.
Because we really, in order to make a habit or break a habit, the science is really clear that it's not just 21 days or 28 days. It's more like an average of 86 days in order to allow something to become automatic in our
Right.
lives, so that we're like, oh, that's right. I have the power to control my breath. I have the ability to control where I'm going to focus. And that, just that recognition that we can take back our power by controlling the very two things that we can control, which is, our thoughts and our actions, or
Mhm.
our attitude and our effort, put differently.
Yeah.
And then that
And
gives us so much power. Mhm.
what I love to think to anyone listening right now is if you've done 5 minutes of breath work a day, you've got to realize you take about 27,000 breaths a day. And so 5 minutes of breath work is only like 100 or 200 breaths. And then you're going back to the old way of breathing, probably the wrong way. And so even listening right now, what we've been talking for maybe 10 minutes, you've probably taken about 1,000 breaths wrong because you're really focused, you're thinking, your brain is working, and your breath is not the primary focus. And so this does take time, and you really do have to be patient. And it's really crazy to think that someone has about 20 breaths per minute. That's like every 3 seconds they're inhaling, exhaling. That's almost like someone panicking, right? Like when you're panicking, you have a very rapid, shallow breath. And we're doing that sitting in a chair sedentary at our 8 to 5 jobs all day long. It's forcing us to rapid breathe. Whereas I breathe about 6 times per minute compared to 20, right? But I've been doing this for years. And so it compounds, just like investing money in a retirement account. This work compounds and it just grows and grows.
Yeah,
Yeah.
and the awareness of just how are we holding ourselves, especially as
Mhm.
we're hunching, and they're calling it tech apnea or email apnea,
Mm.
where people are not aware that they're actually holding their breath while they're checking email or writing something, typing out something, because they're feeling this tension and actually not allowing themselves to breathe while they're under a state of stress already. So yeah,
Yeah.
just that awareness that you can unclench your jaw, open the chest,
Relax the
because the
shoulder.
thymus sits right here. The thymus is right here behind that breastbone, and that is so important for immunity. So a lot of times people will actually fall ill as a result of stress. And most illnesses are stress induced or stress related, as I'm sure you know.
Absolutely. You were talking about the placebo effect, and I have this fun story about an amazing client, Nora.
Mhm.
And the work had been working for her, and she started to catch on to this placebo. And on a group coaching call, she felt a migraine coming on. And so she imaginary grabbed a pill, a triptan, and imaginary put it in her mouth and took a drink of water, and her migraine went away on the call. And it was because she knew about the placebo effect, and like that calmed her down, right? Sometimes just taking a medication calms you down because it's the placebo. You know it's going to take care of you. But she like instantly started feeling better. And we know that no drug instantly works unless you inject it straight into your vein. And even then, it takes a little while, right? But like it's got to go through the digestive tract. It has to get absorbed through the small intestine, and then it's got to get metabolized by the liver. That takes usually 30 to 45, 60 minutes time of onset for drugs to work when taken by mouth. And so it was undeniable evidence right there in front of all these people that the placebo effect is so much more powerful than we realize.
Very true. And having been on some of those drugs, I was even utilizing one up the nose. This is 20, 25 years ago, that as soon as I felt a migraine coming on, I would use this one drug up the nose to try to have a faster delivery. And it would work maybe 40% of the time. Maybe it would dampen the effects a little bit. But we know that, for example, for clients who are experiencing anxiety and panic, they're typically on SSRIs, which take 2 to 8 weeks to actually begin efficacy, because it
Yeah.
needs to build up in the system. And if they're not titrating off, then yeah, they might experience an imbalance, just like if you titrated off taking protein, like stopped eating your greens, you're
Yeah.
going to have a chemical imbalance in your body. And so it's important to not shock the system in that way. And that's one of the things we tell all of our clients: please don't, use your physician and titrate off correctly. But as a pharmacist, what do you recommend to your clients?
You know, every medication, any decision in life has consequences, but so every medication does as well. Um, Especially pharmaceuticals, they're really great. Like, it's really tremendous what some of the pharmaceuticals can do. But what I explained, I was just talking to a client today, is almost all drugs in the world are they're called dirty drugs because they're not selective. If we could make a drug that targets the only area of your body that's kind of injured or working or dysfunctional, then that would be really great. But migraine medications target the whole body. So, like our CGRP inhibitors that address the inflammatory marker in our nervous system, well, it also affects our gut because we have CGRP receptors in our gut. And so a lot of people come to me with like bloating, diarrhea, constipation, IBS issues. Or if you think about like the antidepressants with panic, I mean, those can be used for migraine. Well, where does 95% of serotonin produce?
Your
In our
belly.
gut. In our gut. And
Mhm.
so obviously we're going to have serotonin receptors in our stomach too. And so this drug's not just improving our mood, but it's also messing up our gut where there isn't dysregulation, right? But when you mess up your gut, that affects your mood, right? If you have like chronic diarrhea from or bloating or constipation, like you're not very happy either. So they're dirty drugs, but they can be helpful at times. And so I'm not against them, but they're not a long-term solution, is basically the things that we teach. And the cool thing is when you regulate your nervous system with breath work like you do, or embodiment, somatic work, everything starts working better. Your gut starts working better and it produces
Yes.
serotonin, right? Like Dr. Joe Dispenza, his research on this is, and Tony Robbins, they did it too.
Yeah.
Um, Nervous system regulation creates about 3 to 4 times as much dopamine and serotonin production as an antidepressant. It's
Yes.
just a better drug. It's a better drug. And it has no consequences and it works like that,
Exactly. Works
right?
instantaneously, and we can produce it endogenously, almost on command, especially with the breath.
Yeah. I don't know about you, Sarah. My favorite thing to tell people when they come to me is I tell them, work with me, give me 10 weeks, and you'll be your best drug. And you'll have that drug the rest of your life. No one can take that from you.
That's
You're
right.
going to learn how to be a master. You're regulating your nervous system, your breath, your heart, your brain, your thoughts, your feelings. And no one can take that from you. And you don't have to pay for it till the end of time, like you do a drug or a doctor's appointment or other,
Exactly.
manipulation. So I
Exactly.
love that. That's like what excites me, is empowering people and helping them become their best medicine.
That's what I say. You are the greatest medicine you've ever been given. You've got everything you need inside of you. It's just that you might need somebody to point and show you where to look. And then you have to keep on looking for it, because if we give up all of these good habits, then they're not going to do us any good. It just takes doing a little bit every single day, just a little bit. Well, this has been an amazing conversation, and maybe we can do it again, maybe on another platform or elsewhere. But
Yeah, I'll have to
it,
figure out my social media and get you on mine and like build off of this. I feel like we could talk for days from here.
agreed. I have put a link to your free training in the comments, and I'll make sure that we put it also in the YouTube so that people can watch your free training when they're ready. Thank you, Dr.